Okay, good afternoon, everybody. Welcome to this latest CHF talks. I'm Jo Root, I'm the Policy Director here at CHF. I'd like to start by acknowledging the traditional owners of all the lands that we are meeting on. I'm on the lands of the Ngunnawal and Ngambri people here in Canberra, and I'd like to pay my respects to their elders, past, present, and those yet to come, and honour their custodianship of the land on which we meet. And also to remind ourselves that we have a great health inequality between our First Nations people and others in this country, and all of our health work should be designed to close that gap. So I'd like us all to remember that. Today we've got a webinar on how consumers can be partners in research, and this is a really topical issue, and I'm very excited to have it. I'm particularly glad that Angela from the George Institute has agreed to run this webinar for us. So I'm going to hand over to Angela. If you want to, before you do that, just to remind you, you can put things in the chat. You can introduce yourselves in the chat. You can put what lands you're on. We do have a Q&A function as well, all on the bottom screen if you want to do that. And if you want to target a particular presenter for a question, you can do that, or else it can be a generic question. We'll have a bit of time at the end for the questions. So over to you, to Angela, and your amazing panel of speakers.
Thank you so much, Jo, and thanks to Consumers Health Forum Australia for enabling us to have this session today. It's really exciting, and as Jo said, we've got a fantastic panel of people brought together to talk today about this opportunity to bring consumers, researchers together to improve health in Australia. Before I go any further, I would just like to acknowledge the country that I'm on, the land of the Darramurigal people of the Eora Nation here in Sydney, and to pay my respects to elders past and present, and extend that to the traditional owners across the lands we're all meeting on today, and to also welcome any Aboriginal and Torres Strait Islander people who might be with us today. Now, as I mentioned, we've got a great panel of people speaking with us today, and it's pretty packed, and we hope to have some time at the end for some questions. I guess the purpose of today is to talk about the opportunities that there are to participate in research, for researchers and consumers to work together, and specifically to look at the Join Us register that a number of us have been working on over the last 12 to 18 months, and to look at potential for people to join us in that. I will introduce firstly Dr. Claire Arnott, who has been right at the forefront of this research register. Claire is a cardiologist and founder of the first women's heart clinic, I think, in Australia, and at the forefront of lots of really exciting research, but very much in her role as a clinician, and with the motivation to improving the health of her patients. So I'm going to hand over to Claire to get us started today. Thanks, Claire.
Thank you so much, Angela, and thank you everyone for inviting me. And of course, my doorbell went off at exactly that moment, so please excuse the musical background that I have. I have one whole slide I'll just share that if that's okay. It's not a very exciting slide, but nonetheless, I will share it. Can everyone see that?
Yep. Okay.
Look, so I'm going to spend the next 5 minutes talking just a little bit about myself and what I do and why I do research, and I'm sure 5 minutes will be more than enough on me. But as Angela mentioned, I'm a clinician researcher. So I am a cardiologist by trade, and I'm a staff specialist cardiologist at Royal Prince Alfred Hospital. And I'm also a cardiovascular researcher at the George Institute for Global Health. And as Angela kind of mentioned, I really came to research through my clinical work and was inspired to do research because of my patients. And I might just speak a little bit about that journey. So as I said, I'm a cardiologist. I'm an imaging cardiologist, but I also work very closely in women's heart disease, heart failure, and pregnancy medicine. And one of the things that I do is I set up Australia's first women's heart clinic at Royal Prince Alfred Hospital. And some of the conditions that I treat in this women's heart clinic are coronary dissection, MINOCA, preeclampsia, HFpEF. Now, I'm saying a lot of these terms that probably will mean, not a lot to a lot of people listening today. And I suppose there's method to my madness, because most of these conditions are really poorly recognised. So they're really poorly understood in the community generally, from clinicians, from cardiologists, from general practitioners, and poorly understood, poorly treated. So we have poor outcomes for my patients, and they're really poorly researched. And so what did that lead to? Well, it leads to people who suffer and, very rarely die from things that are potentially preventable. As a clinician, that's heartbreaking. So it's heartbreaking to have patients that you see who you cannot help. Patients who ask you questions about what this condition means to them, or how can they feel better, or what does this mean for their children, or what does this mean for the thing that they had planned in a decade. And you can't meaningfully answer those questions, and you can't make them feel better. And so I suppose it was that really inspired me to get more heavily involved into research and to try and change that in any small and hopefully meaningful way. So I did my PhD in medicine at Royal Prince Alfred Hospital and then moved to the George Institute, where I am involved with and run many clinical trials around cardiovascular research, pregnancy medicine, heart failure, and diabetes. And I suppose some things that I wasn't prepared for when I started research, or probably didn't understand very well, is all the challenges that would occur in research. And what do I see? Well, often many of our studies and studies of my colleagues fail to recruit. So, often we can't get enough participants to answer the important clinical questions that we're asking. Or we can't do it in a timely fashion. And that might sound trivial, but if you can't meet timelines, you often can't pay for your study. And so what you end up doing is having a study that can't answer the clinical question, or you cannot afford to continue the study. Not only is that a missed opportunity, but it's also a waste of people's valuable time who have committed to that study as well. And I'm talking about all of the people who dedicate their time to be participants in those studies. So it's costly in many ways. The other thing that I found, which again is probably unsurprising, is the systematic exclusion of women, and particularly women of childbearing age, from clinical trials and other research. Unfortunately, I also found underrepresentation across many high-risk groups. There's certainly underrepresentation of our culturally and linguistically diverse Australians in research, those with mental health problems, our Aboriginal and Torres Strait Islander population. So what we're really doing is doing research that is often relevant to a small group of individuals within Australia and isn't largely representative of everyone in Australia. And I suppose the other thing that is really frustrating for me is studies that don't answer the questions that are most important to my patients, or most important to the people that are involved in the study. So a trial that doesn't start out with the question that's most important to the people it affects. And that happens all the time. So I suppose my clinical experience and my research experience has made me very passionate and very motivated to do a few things. So the first is to answer questions that are important to my patients and to the community. And I think that, you know, that's when we have to stop as researchers and clinicians and listen. And I think that's really important at the beginning, before you've even conceived of your study. I really want to work hard to make sure that my studies meet their outcomes. So they're planned in such a way that we can recruit, that we can meet timelines, and that we can give you meaningful answers. And I think, you know, Angela will speak a little bit to how we hope with Join Us to achieve that. And also my great hope is that in all our research moving forward, that there'll be diverse and representative populations that will actually answer questions that are relevant to all Australians. So hopefully, Angela, I was within 5 minutes.
That was fantastic. Thank you. Thank you, Claire. And we really appreciate you being here today, because we know that at the moment with COVID and everything else, your work in the hospital is a little bit crazy as well. So we very much appreciate you taking the time to talk to us, because I think it is quite inspiring to hear, you know, that the clinician's perspective on why this research is important, and it's all about the patients. And so that's incredibly helpful and motivating. Thanks, Claire.
Thank you. Thanks very much for asking me. I will have to jump off early, but if there are any questions, please share my email. I'll be happy to answer them.
Will do. Thanks so much,
Thanks
Claire.
for asking me.
Thank you. Yeah, so that, I mean, I suppose in only a few moments, Claire's been able to, I guess, describe the motivation behind the development of this, the Join Us register that we'll talk a bit about today. We're going to hear from some researchers now who working on different studies, different types of studies, and the reason for that is that sometimes I think it's difficult to even sort of really understand what it means to participate in a research study and what kind of study might that be. And we often talk about clinical trials and testing drugs and research like that, and they're incredibly important, but they're not the only types of research that are going on all the time out there to improve the health of Australians. So the register that we have developed is looking at connecting to people to all sorts of research, many different types of research across the health and medical sphere. So we've invited two researchers today, and first off I'd like to introduce Mallory Trent, who is working with the Biosecurity Research Program at the Kirby Institute at UNSW, to tell us a bit about the study that she's responsible for, and, you know, I guess why it's important and why people participating in these sorts of studies are important. Thanks, Mallory.
Sure, let me just share my screen. I've just got one slide. All right. Can I just confirm that you can see my slide?
Yes.
Perfect.
Yep.
So as Angela said, my name is Mallory and I work at the Kirby Institute at the University of New South Wales. And I've just been asked to speak a bit about the BREATHE study, which has been going on for the last year and a half. Basically, the story of this project started in the summer of 2019, which I'm sure everyone will remember was just an absolutely horrendous bushfire season for all of us. But most of all for just the thousands of Australians that live with chronic lung disease like asthma, COPD, emphysema, chronic bronchitis, etc. So there's quite a lot of evidence that during times of poor air quality, individuals with chronic lung disease have worse symptoms and a higher risk of hospitalization. And this has really been echoed by a lot of the participants in our study who find bushfire season really difficult to manage. And as well, they feel that their struggle has sort of been forgotten and their issues haven't really been given proper attention. So the current health advice is for folks to just stay indoors and seal up all the windows and doors whenever the air is smoky. However, that's not really practical for the majority of people. And for those of us that have been under stay-at-home orders, it's not really a great way of living. So some individuals have started taking to wearing masks or respirators whenever the air quality is bad. However, there isn't actually any clinical data to support the use of masks or respirators against bushfire smoke. So that's sort of where we came in. In February of 2020, we received a grant from the Australian Medical Research Futures Fund to run a clinical trial to determine whether masks or respirators performed as well or better than outdoor avoidance in preventing respiratory symptoms during bushfire season. So essentially how this works is we've recruited individuals with chronic lung disease living in bushfire-prone areas, which turned out to be most of Australia, and randomized them into one of three groups: a surgical mask group, a respirator group, and an outdoor avoidance group. Throughout the study, we followed them up daily via just a short survey that's sent through text message throughout the backburning and bushfire seasons, and just asked them a few questions about whether they were exposed to smoke, whether they had any sort of respiratory symptoms, whether they had to increase their medication or consult their doctor, whether they used a mask, those sorts of questions. And then we've also had a few in-depth interviews and focus groups with participants to try to really understand their experiences with bushfire smoke, as well as their experience with the interventions in this study. And so kind of the goal of this is just to see, what is the rate of symptoms of, seeking medical care in the different groups and how do they compare? We're currently in the second year of our study. Despite a few setbacks, namely COVID, mask mandates, stay-at-home orders, and a particularly rainy summer, I think this work is really important because, as Claire sort of mentioned, we're not just looking for that clinical data, we're working directly with the people most affected by this issue to try to find the best solution for them to live with bushfire smoke and come up with the best recommendations for them that not only provide the best outcome, but are the easiest to actually, manage in your day-to-day life. If we give a recommendation, but it's not really practical, that's also not very helpful. So that's just a bit of background on the study. I've just got our webpage here where we've got more information if anyone is curious. You can also register your interest if you wanted to participate. We're still recruiting people. If you have any questions, I've just got my contact info there at the bottom. Yeah, that's pretty much all I wanted to share.
Great, thank you, Mallory. I think it's a very, mind you, it's here in Sydney, a wet, rainy sort of a day, but we were so aware of the impact of that smoke over that summer. And as you say, sometimes people do feel forgotten, and it's really reassuring to know that there is work going on to understand that better. So thank you for that. Next, I'd like to introduce you to Ashley Hart, who, as a PhD candidate, is working on research at the George Institute and working with the food policy team there to tell us a bit about a study that that she's working on at the moment around online grocery shopping. Thanks, Ashley.
Thanks, Angela. Hi, everybody. I do have about 7 slides to share, so I'll just get that set up. Can you see my screen there?
Yes.
Yep, no problem.
Looks like the screen has just frozen. Sorry, sorry, Angela, maybe you can skip and come back. My screen's just frozen.
Oh, okay.
I'll just fix that up.
No.
Sorry.
The joys of sessions via Zoom.
Thank you.
Okay, no worries. Thanks, Ashley. Well, we'll hear from about that study in a moment. As I said at the beginning, one of the, the goals of this webinar today and of the Join Us register is to connect researchers and the people, the consumers. So we're really, really privileged today to have two people talk to us about their experience of participating in research. And first, I'd like to introduce you to Mr. Norm Morwood, who I think is in the Sunshine Coast, to tell us a little bit about the study that you've been involved in and some of your motivations and what you've got out of that. Thanks, Norm.
Okay, thanks for the opportunity to hopefully help some people. The study I'm involved in is called the Trident Study, which is triple therapy prevention of recurrent cerebral disease events trial, which is a pretty long title. And it's basically a study of the use of 3 combined blood pressure modifying drugs to reduce the chance of hemorrhagic stroke. I had a small hemorrhagic stroke in 2019, and following that, the treating doctor in the Sunshine Coast Hospital, Dr Rowan Grimley, suggested that this trial might be appropriate for me since I've been on blood pressure use for about 40 years of some sort, and he thought this particular medication might do a good job of keeping the blood pressure at a low level, which would hopefully prevent another stroke. So I was pretty happy to go on that. It really wasn't much of a decision, really. It was just, why not? I didn't know much about medical trials at the time, but it seems to have worked out really well. The trial, there's an initial trial of the medication to see what it was going to do to me anyway. At the time I was continuing to take my other medication, and so I took this extra medication on top of that. My blood pressure dropped off pretty dramatically, so we quickly went off the old medication and stayed on the new medication, which is supposed to be I'm either on a placebo or the medication. It seems to me I definitely am on the medication, although we don't know that. What has been my experience like? It's been just fantastic. I like the regular 6-monthly review appointment with Dr. Grimley. It's very pleasant and an interesting experience. I'm sure that I'm getting the best medical treatment that I could get for the few little conditions I get from my minor stroke. And the running of the whole thing is done exceptionally well by Karen Simmons. Very friendly and efficient, and a great assistant to Rowan in that she does much of the testing and recording and that sort of thing on the 6-monthly visits. The trial goes for another 4 years, I think, which is probably see me out, but anyway, that's good. That's about all I've got to say.
That's fantastic, Norman. I think with the care that you're getting, I think 4 years and plenty more by the sound of it. So it sounds like you have a great relationship with your doctor and the researchers, and it is that link between the clinicians and the researchers again. Looking for the best care for their patients.
Yeah, I'm sure it just works out well for me.
Yeah, well, that's great to hear, and thank you so much for sharing that. And I'm sure it's good for you and for other people who will benefit from that study. Okay, thank you. Thank you. Ashley, shall we go back to you? Are you, yeah?
Yeah,
okay.
all good. Thanks, Angela.
So back to the researcher perspective. Yes.
Okay, can you see the screen again now?
Yep.
Yes.
Thank you. Thanks very much. So hi, everybody. Apologies for the tech issue. We always do rehearsals half hour in advance, and then something always ends up going wrong. So apologies for that. So my name is Ashley. I'm a research assistant for the online grocery shopping trial, which seeks to understand how information influences online food shopping. And I'll be presenting an overview of the project for you today. So first of all, what is it? So the online grocery shopping trial is a novel randomized controlled trial that has, it's rarely been done before, that leverages the online mode of grocery shopping. It's investigating whether information presented to online shoppers influences how they shop and if there are any associated health effects. The George Institute has developed a novel web browser extension that augments the online supermarket shopping experience, and it collects participants' purchasing data for analysis. During the trial, the browser extension may show interpretive labels about the foods that participants are intending to purchase. The duration of the trial is about 16 weeks, which consists of an initial 4-week run-in period where participants will be assessed for a final time for suitability to progress to the main 12-week trial period. What's involved? So most importantly, participants just need to do their usual grocery shopping online for the duration of the study using a computer with the web browser extension. Participants will also be required to complete a number of other activities almost entirely from home, online, or over the phone. And it includes blood pressure measurements, which will be done at home with a wireless blood pressure monitor that we will mail out to all participants. Urine samples, which are done at the local pathology of each participant's choice, but they won't be required if there are any lockdown restrictions in place in their local area. And the 24-hour dietary recalls and surveys. And also on top of that, some participants will be invited to do an optional questionnaire interview over the phone at the end of the study, just to seek feedback on the web browser extension. So overall, participants won't be required to attend clinical visits other than the urine sample collection. So who can participate? If you're an adult aged between 18 to 75, if you live in Australia, if you do your grocery shopping online at Woolworths, or you're willing to, for the duration of the study, like if you're able to shop online at Woolies. If you're the main grocery shopper for your household, and if you have high blood pressure. So that's the eligibility criteria. So who cannot participate? You can't participate if you have an advanced medical condition such as congestive heart failure, metastatic cancer, chronic kidney disease or failure, advanced liver disease, or cirrhosis, etc. If someone else in your household is already participating, and if you have an upper arm circumference of more than 42 centimeters and you would require an extra large blood pressure cuff to measure your blood pressure. The wireless blood pressure monitors that we send out, unfortunately, they only provide the standard cuff size. And finally, if you're unable to use a computer with the web browser extension for the duration of the trial. So we are finding there are a lot of people who we find aren't eligible at this point just because they usually use their phone or iPad, or if they don't have a computer for the browser extension. So what's in it for you? So in recognition of your commitment to the trial, you'll be given $50 worth of Woolworths grocery vouchers, which are redeemable online or in store. $25 for providing blood pressure measurements at the beginning of the study, and another $25 for providing blood pressure measurements again at the end of the study, which we'll remind you about. If you are selected for and participate in a brief phone interview at the end of the trial period, you'll receive another $25 shopping voucher. So it could be between $50 to $75 in total. You'll also receive a wireless blood pressure monitor to keep at the end of the trial for your own personal use, and that's valued at $179. So we do hope to use the information from this research to develop new ways to help consumers to choose products in line with their health and nutrition needs. So participants will be contributing to advancing this important research. If the tool proves to be successful, we will seek Therapeutic Goods Administration registration of this intervention as a medical device, and we'll seek to market the OGS web browser extension to food retailers, health insurers, directly to consumers, or a combination thereof for scaling so that we can help more people when they're shopping, doing their grocery shopping online. So thanks very much for listening. Feel free to contact the research team to register your interest. So those are the contact details on the screen. So ogs@georgeinstitute.org.au. And those are the two contact numbers. Mine is the 080524839. Thanks very much again for listening, and yeah, please do pop your questions in the chat box, and I'll be happy to stick around and answer those. Thanks very much. Thanks, Angela.
Thanks so much, Ashley. That's great, and just another example of a type of research that's really important, especially when you look at the longer term and the opportunities to scale that up, and the potential that could have to improve health. So thanks for that, Ashley. I'll now hand over to Lindsay Lipman, who's been kind enough to join us today as again another participant in a research study. Yeah, so thanks for being here. I know it's not always convenient, but thank you for talking to us today about your experience, Lindsay.
Okay, yes, thank you for having me. Very kind of you. Look, I've also always been interested in diet and exercise since I did a science degree at university, and I have always been interested in being healthy and strong. I've been on quite a few studies. I'm still on the 40 Up study, which I've been on now for 26 years. I was on an NRMA driver safety study where the car was fitted out with cameras, which looked at your eye and where your eye was looking as you were driving. And just recently, two neuro studies from the Neuroclinic. One of them was a 3-year study, which has just wound up, and that was looking at your cognitive deterioration over time. You would do a lot of Cambridge-style tests to check your cognition. And the one that I've also just been on for a year was a balance assessment one. One of the criteria to be on that is you had to have fallen, and I had fallen a couple of times. And that study is called Standing Tall, and you were supplied with a stepping block that sort of mimicked being a curb. So stepping over curb and guttering, you had a wooden platform, and also you had a piece of foam that you would do exercises on to see how your balance was. And I like to participate in studies because I like to see what I can do to benefit society. My mother was a big contributor and donated her body to science, and the University of Sydney used her body for doing some research on, and she was able to participate after her death in that. So we're part of a sort of family that likes to do what we can and contribute what we can for society, because we believe studies are an important way to give back. And that's one of the reasons I'm a happy participant. I've always found studies to be an important and integral part of health research. And as our other, the professional side have said, without participants, they can't do studies. So I'm a big proponent of that. and I've always found them to be not too much of an imposition into your day, and generally you're in studies where there is some applicability to your future. And so yeah, my dad actually had strokes and things like that, so you know, hopefully I won't have any, but you know, I think Neuro are a wonderful organisation, and as I say, I've just finished with those 2 trials.
Thank you, Lindy. It's great to hear the amount of support and you know, your involvement in research. And it's, you know, without people like yourself and Norm, we'd be really struggling to you know, to advance in so many different areas that you're talking about, you know, road safety and various other, you know, a variety of falls. All of those things are so important. And you know, I think going back to what Claire was saying, sometimes when you just can't even answer a patient's question, you know, and that comes from the fact that there's no research in a space. So thanks to both yourself and Norm for being involved and for talking to us today about that involvement. So really appreciate that. Thank you.
My pleasure.
My pleasure.
Thank you. Please do stay around. I'm sure there will be some questions at the end. I'm going to speak now. I think it's my turn. So I'm just going to share my screen, and hopefully this will work. Can you see my screen? Yes, good.
Yes, yes,
Oh,
yes.
fantastic. Thank you. You're never too sure. So I'm the project manager with the Join Us Research Register, and began right at the start of this, which was in February last year, just before we all locked down. And it really came from, you know, you heard from Claire earlier about her motivations about how do we make this easier? How do we make it easier to bring the community and researchers together? And so we started down this path, as I said, around 18 months ago. And it was really very much initially the George Institute with Claire and Professor Bruce Neal, and also a partnership with UNSW that got this started. And as Claire said, the recruitment, bringing people into studies, whether they're clinical trials or any sort of research, is difficult, and every individual researcher struggles with it. As she mentioned, we're just looking at clinical trials. You know, for example, the one that Norm is on, it takes time to find enough people. You know, you will have a target of, you know, X number of people, and to actually find the people that meet the criteria takes time, and targets are often not met. And sometimes they take, you know, there'll be 20% of trials that meet their targets, but it takes a really long time. So 20%, only 20% meet their deadlines in terms of time. And that extra time, as Claire said, is extra resources, extra money that it costs. But there is an opportunity. And, you know, I think hearing from Norm and Lindy today, and, you know, the studies show that 89% of Australians are interested in health and medical research. You know, it's something we trust and we care about. 91% of Australians believe there's a role for technology in helping to better manage their health. So those advances are important. But really importantly, we know that while the majority of people would be willing to participate, most people never get invited or never even know about the research. So this is our opportunity, and this is what we're trying to influence. When we started last year, we looked around for what was around overseas, and we've based this Join Us register that we hope will help bring researchers and the community together. We based it on the SHARE register, which was set up in Scotland a number of years ago. We started off in a very similar way. We've kind of diverged a little bit, but the principles are much the same, inviting people to consent to being contacted should a research study come up that they might be eligible for. So in simple terms, that's what it's about. The SHARE register now has around 285,000 people in their register. In the US, there's one called Research Match, which is run by Vanderbilt University, but National Institute of Health provides funding. They have around 165,000 volunteers, they call them. In Scotland, it started off at, I think it was Aberdeen University, but then has been taken over by the National Health Service there. So what does this Join Us register do? As I said, it's about bringing community health and medical researchers together. And also, as Claire said, it provides more opportunities to participate to more people. That diversity goal is really important, that we want to make sure that the research that's done is of benefit to the whole population, not just to a subset of that population. There's also the potential to create research opportunities with the data that's collected, de-identified with, you know, this is quite a separate thing to people being involved in the research. It's just using de-identified data. And it increases research efficiencies. And to that end, you know, for every dollar invested in medical research, you know, the economists tell us it leads to a $3.90 return in health benefits to Australians. Now, if we can make it even more efficient and not spend as much money on the recruitment, you know, we get even more value for our dollars. So, you know, that's another reason to think that this is important. So I don't have long, and it's a very sort of, it's going to be a very potted description of Join Us, but I just wanted to show you how it works and how we want to really build some momentum around having a large number of people participating to really get research moving. So the entire Australian community is eligible over the age of 18. In Scotland, the share register is open to children to the age, above the age of 11. You know, we're open to looking at that over time, is to include younger people. Participants, the community, agree to be contacted about research opportunities. And then what the Join Us register does is to connect people with the researchers. There's also an optional part of the study, of the register, which is around consumers consenting for their de-identified data being used for ongoing research. And I'll talk a little bit about that in a minute. So signing up is really simple. It's all online, on the computer or on your phone. And we'll quickly have a look at that if the technology works in a sec. Provide contact details, so your name, sex, date of birth, postcode, and phone number, email. Goes into our Join Us database. And then there is a very brief health survey that people also complete, which is a tick the box exercise, very quick. The health information and the personal information gets split up immediately and go into two different places. So at no point is anyone's health information ever stored with their name and their contact details. So that secure database is what we've set up with UNSW. It's called Erica. It's a very secure platform that holds any health information that's collected. The researchers come to us, though, Ashley and Mallory actually have both come to the Join Us register and said, we need people with, you know, for example, high blood pressure in the OGS study, or with, you know, lung conditions. And what we're able to do is to pass that information into that secure register and find people with those conditions. So what comes out at the other end, sorry, I'm trying to make it as simple as it can be, but it is sort of a complex process to keep it safe. What comes out of that in that purple box is a list of ID numbers, and those ID numbers are the people who are eligible for that study. So there might be the people with the blood pressure and whatever other requirements there were. We match those up with an email address and send those people information about the study. And those people can then decide whether they're interested or not and contact the researcher. We never provide somebody's personal information to the researchers. It's up to those people to respond. So I said this, so that's the whole piece of how you can get matched up to studies. For some people, they might be interested in also consenting to their de-identified health data. So this is data that's held by the Commonwealth, and it's Medicare benefits, pharmaceutical benefits, held securely, de-identified, placed in the register, so that in future researchers can come along and kind of play around with that data, answer some questions, you know, what's the long-term effect of people who take a certain medication over time, that sort of stuff. It doesn't involve participation, it's just using accumulated data. So they're the two elements of the register. This is what it looks like, and currently we have around 830 participants in the register, and they are from all of the states of Australia. It's national. It's what we call disease agnostic, which means that you don't have to have a particular condition. You don't have to have any condition, because we need healthy volunteers a lot of the time as well. And we also have 43 partner organisations from the consumer space, from research and from health, supporting us as we develop this register. So I'm just going to see if I can click on this and go to the website. Is that coming up? It's maybe. So you may have seen the website. This is the home page for the Join Us website. There's lots of information on here sort of about how the register works. I've just, you know, taken you through very quickly. There's also...
Sorry, Angela, I think
yeah.
we still see your PowerPoint slide.
You're going to have to reshare your screen, Angela.
Okay. Okay. All right. Well, actually, I'm nearly done, so I might just not do that. So, stop share. Okay. All right. I thought that was being optimistic for me doing that. So I'll pause it there, because I know we haven't got much time. But all I was wanted to say at the end there, it's a very simple process of going online, providing a consent. Takes a few minutes. There is a health questionnaire that tells us, you know, whether you've been, you know, what conditions you may have. So that puts you in the register. Then when people like Ashley or Mallory come to us, we can help to match you up to a study that might be relevant for you. So I think that's the story to date. We're keen to get you know, as much discussion and thinking around this. I know you know, one of our goals, as I've said, is to ensure that we have a really diverse and representative population. So we're looking at how do we connect with people in rural and remote Australia? How do we connect with people from culturally, linguistically diverse backgrounds and Aboriginal and Torres Strait Islander people? So that is all work in progress. We've got the infrastructure here. Now we're working hard to get our a community connected up with our researchers. So I'll stop there, because I know we haven't got much time, and I will hand over now to the next two speakers are from organisations that have come on board as partner organisations with the George Institute and UNSW to help us develop this register. So first off, I'd like to pass over to Marianne Young, who's head of the Kinghorn Centre for Clinical Genomics at the Garvan Institute, to talk a bit about sort of what it means to be a partner in this work. Thanks, Marianne.
Thanks, Angela, and thanks for the opportunity to present here today. As Angela said, I'm from the Garvan Institute of Medical Research, which is located in Sydney, and I'm a clinician researcher myself, and much of what has been said today, particularly by Claire, really resonates. It's that when you sit with patients or people, that's where your research interests come from a lot of the time, that they actually say things that make you think about taking that somewhat further. But it's not without research participants that we can do our work. And one of the reasons that Garvan came on board as a partner organisation with the Join Us is, I suppose, the reputation of the George Institute in the work that it does. So you know, the mission of the George Institute is to improve the lives of people in disadvantaged circumstances. And so it's really important for the Garvan that we contribute to such programs. I think the other thing is that the values of the George align with the Garvan, and also the research interests align as well. So you've heard about, you know, a trial like an online grocery shopping trial. Who would have thought anyone would have ever thought of something like that? Right through to looking at the impact of salt in people's lives, particularly in regards to heart disease and diabetes. Other research interests at the George are around mental health, COVID. So they have a reputation of having broad and diverse research projects. And the other thing that attracts Garvan is the genuineness with which they interact with research participants. And that's something that's really important. I have seen at times where research participants have not been treated well, but the Join Us register has genuineness in regards to their engagement with research participants. And that includes people from groups who may be disadvantaged and haven't had a voice in research before. And they're a really important group of people to hear from in regards to research moving forward. Partner organisations include other medical research institutes, universities, and also very important consumer organisations. And some of the consumer organisations that are partners in this Join Us register include the Australian Breastfeeding Association, which I thought was a very interesting group to partner in, and they're really active participants in this. We've got the Genetic Support Network of Victoria, also the Consumer Health Forum of Australia, where we are today, and the Australian Men's Shed group. So these are ones that just, I suppose, tickle my fancy. And there's lots and lots of consumer groups who are partnering in regards to this Join Us register. What does the Join Us register bring research participants? I think it brings, it lessens the burden for them in regards to research. And it's a great resource for people like myself who are researchers to go and actually seek people who are interested in participating in the type of research that I might do. Anyone who's interested, get on board. And if you're from an organisation that could be a partner organisation with Join Us, it'd be really great to have you on board as well. So thanks very much for the opportunity to present.
Thanks so much, Marianne. It's great having yourselves and the other partners on board. It's a really rich sort of discussion that we have, and yeah, it's very exciting. So thank you. Next up, and our final speaker for today is Melanie Gentgel, who's now with the South Australian Health and Medical Research Institute, SAMRI, and Clinical Trials Director. And Mel has been, again, involved from, you know, when we first opened up to the partner organisations, and I know is really committed to the engagement and involvement of consumers. So it's great to have Mel on board. So I'll hand over to you now, Mel. Thank you.
Great. Thanks, Angela. And again, thanks for inviting me here today. But let me just start off by thanking Norm and Lindy for the incredible work that people like you do participating in clinical trials. And as you both said, without participants, clinical trials don't happen. Without clinical trials, we don't get advancements in the medications that save people's lives or that change people's lives, or really just an understanding of medications that don't work. So all of that information is absolutely critical, and we thank you for your efforts, and we thank all of the participants around the globe that are involved in clinical trials. And never has there been a more important time, and I think COVID has shown us the importance of clinical trials and how they help us as a society to improve outcomes for the general population. So I'm going to have a slightly different approach in what I'm going to talk about. And I'm going to talk about not only the role of people like Norm and Lindy, who are actually participants in clinical trials, but also where clinical trials are heading and where research is heading more generally, which is a more patient-focused approach where we have consumers and patients involved at all stages of the research lifecycle. And I thought it was really interesting. So thanks, Ashley and Mallory, for presenting your trials. But I'd like to hear, and we're not going to have time to talk about this today, but how actually patient involvement right from the design and concept stage may have slightly changed, particularly when I think, Ashley, at your inclusion-exclusion criteria and access to technology. So the many people that will be excluded, so particularly diverse and underserved groups, purely because of their lack of access to technology. And if participants had been involved in the design of that study, might it have been slightly different and been slightly more inclusive? It's not a criticism, it's just one way that we know that actually participant involvement can help to open research to more people. And there's a really good motto that has been used in this space, and the motto is "Nothing about us without us." And what that essentially means is that without the participant voice, without consumers telling us what's important and how research should be designed, then we're really not going to be able to answer those important questions, because we really won't even potentially be asking the right questions, because we need consumers and patients and people with lived experience to help guide us in the decisions around what are the right questions we should be asking and what kinds of clinical trials should we be running and how should they actually be managed and implemented to make sure that there is greater inclusion, that less people are excluded, particularly those groups who have historically been excluded, including groups from culturally and linguistically diverse backgrounds, Aboriginal and Torres Strait Islander people, and as Claire mentioned, women, and particularly women of childbearing potential. So what does consumer involvement in research look like? And look, there's been groups across the globe that have done some incredible work in this space. So out of the US, there's a group called PCORI, which is the Patient Outcomes, and I can't remember the full acronym, but we can send you some links to those groups. In the UK, there's a group called Involve. And here in Australia, we've had groups such as ACTA and CTIQ, who have created some really good guidance for researchers, but also importantly for consumers about how they can become involved as advisors to research right across the life cycle. So from the very first concept of what questions should we be asking to how do we then share that information once a study is complete with the public. And Angela, I might ask you at the end of the study to actually send the link to the Consumer Involvement Toolkit, particularly the one for consumers that describes what their involvement will look like, because it tells you how your involvement outside of being an actual participant in a clinical trial can lead to much greater benefits to the research that we conduct. So just as a highlight, the kinds of things that the richness that consumers bring to research, including helping us to set research priorities, helping to minimise waste of time, and time equals money when we're talking about research. They help us to contribute to critical first-person knowledge and understanding of the lived experience that they bring of a disease or condition. And without that lived experience, we really are only clutching at straws thinking that this is the right outcome for a particular group of people. So it's that real world experience that they contribute. It also allows consumers and patients to become an important and critical part of a team of science and health professionals. And it really is something that researchers embrace, partly because they now need to for funding, but also because they recognise the downstream benefits of having consumers involved. But importantly, it's about positive outcomes downstream for other consumers, other people who suffer these diseases or conditions, and how you contribute to improving outcomes for the population more broadly. So I absolutely congratulate the George Institute and Join Us for what they're doing about connecting researchers to participants. and really encourage all of us to think about sharing that information and joining us, but also any participant that's listening today to think about how you can actually become more involved in determining what research should look like in Australia. That's it for me.
Fantastic. Thanks, Mel. That's a really good way to sort of finish, I think, the discussion around the register. And I know we're on 2 o'clock and we haven't got, and there are questions in the box. Jo, are we able to respond to those by email, the Q&As?
We will, yeah, thanks, Angela. We will collect all the questions, and if you want to, any of the participants want to send us answers, and when we send out we usually send out an email after the event with the link to the recording of the event. So we'll try to put the answers there. Okay. So we'll send out the answers to participants, and any links such as the link that Melanie had, we can put all of that and the contact details for presenters and things. We can put it together as a package. We'll talk to you about that and send it out to participants.
Fantastic. That's great. Thank you. And I saw, there are a couple of questions on there that, around, I think, Judy, whether you can participate with end-stage renal failure. And I would say that the types of studies and even the sorts of things Mel is talking about, and just the opportunity for us to use Join Us to connect with people who are interested in research. And it might not be that you end up in a clinical trial or something, but there might be a focus group. There might be, talking about your experience of healthcare. So really it is open, to everyone, because research is a very broad space. So on that note, and I'm sorry we didn't get to questions, but we will respond to you. Thank you so much, everybody, for being a part of today, and to Consumer Health Forum for having us along today. Jo and Jenna for putting it together for us. To Norm and Lindy, fantastic.
Thank you.
Wouldn't have been able to do it without you, so thank you. Ashley and Mallory, great to hear your studies. It's really, fascinating to hear these sort of ideas as well. And thanks, Marianne and Mel, for your ongoing support of the register as well, and for being here today. So on that note, thank you, everyone, and we will be in touch. Thank you.
Thank you very much.
Thank you.
Bye.
Thanks, everybody. Bye-bye.
Bye.